I hurt my neck really bad when I was doing muscle ups. That was pretty intense. And I came in and I was locked up. So we did a little bit of the manual, the past stuff on it, just to get it so I could actually move a little bit. So then you could do the counterstrain. I just remember the manual stuff. Okay, got it to move just a little bit. After you got done with like 3 minutes of pressing on an area with the counterstrain, okay, Tim, bend your neck to your right. And it actually went right. And I was like, unbelievable. Every time I come in, that's the word that comes into my mind. Unbelievable.
This is Good Outcomes with Dr. Dave. Welcome to our Patient Perspectives segment, where you'll hear firsthand from patients about their health journey to good outcomes. And I'm your host, Dr. Dave. Welcome, everybody, to another segment of Patient Perspectives. And today I have a really great guest, Tim Krug, who is the owner of Dude Wash. That's one of the best things about this segment is I get to highlight local businesses. And so, Tim, why don't you tell us a little about yourself and your business?
Yeah. So a little bit about me is I originally came down to Florida from Pennsylvania, attended Pensacola Christian College. And shortly after that, I got married and then started up Exterior Wash Experts. I did that exterior cleaning company for 6 years and then just recently acquired a local company called Dude Wash. I like the branding better there, so I went with that branding there. But a little bit about like what we do and serve the community is through helping homeowners make the exterior of their homes look pretty, whether it be their shingles or their exterior siding or their driveway. It gets hot out in the summer, right, Dave?
Mm-hmm.
And it's a lot of hard work to do all that. So that's one of the ways we serve Pensacola and make it look beautiful is by cleaning up one home at a time.
That's amazing. A little sometimes backbreaking work, should you say?
It is backbreaking and it's got a lot of aerobics to it. So we definitely get our steps in a day.
So thanks for sharing. And I really appreciate you being here because I think you have one of the better perspectives because we got to working with one another prior to me, converting to a counterstrainer. And so you got to see my traditional mechanical model work. And then you got to see how a counterstrain model works and pretty much the transition in between. Because I know you've had some on and off, injuries along the way. And so if you want to just take everyone back to the beginning, kind of maybe when you first injured yourself and what you were dealing with and for how long you were dealing with it.
It's interesting you say that because the first time that I injured myself, I was in basketball practice, varsity basketball practice. And there was this guy that could lay on his back and he could jump up on his feet from his back. And I thought that was incredible, like the most amazing thing ever. And I was like, well, I wanted to do that, right? That was cool. So I'm down in Pennsylvania, we have basements, right? Because of tornadoes and stuff like that. So I'm down in my basement and it's basically got a solid concrete floor. I think it's got some thin, like vinyl floor over top of it, but it's hard.
Mm-hmm.
That's the point, right? Had no carpet in it. And I'm trying this move and I could not get this move. And I'm just hitting myself like on landing on my back. The next day, I could not twist my back. I couldn't go right. I couldn't go left. I couldn't move my head up, down, look right or left. I was pretty much just stuck. My back would
You
not
just
move.
like laid on your back, pounding it into the hard floor for hours.
Yeah. I wanted to do it. Right. And I'm, young. I was like, I can do this. Right. And I didn't get it. But what I did get is a really bad messed up back. So I couldn't move my back. So we went to a chiropractor. First time I ever went to a chiropractor. I was 16 years old. And basically what happened was in there, they heated your back up. So it was really nice and warm, spread some gel over it and all that, got everything loosened up. And when the lady went up in Pennsylvania to pop my back, like it just felt like every vertebrae popped in my back, all the way up to my neck and then my low back and everything. Well, when that got done, there was still no really good relief, obviously, because everything was so inflamed. Well, the next day, it was way worse.
Oh, really?
Oh, it was so bad. I was on ibuprofen all day long. Like, just sitting, I was almost sweating. It hurt so bad. And it was like that for days. And that's what initially started the back injury.
I may have forgotten that. I know
I don't think I actually told you.
Yeah, it seems that is more... maybe that is news to me. That's interesting. So then eventually that inflammatory process probably calmed down. You probably weren't like that the whole time.
It took about a week or so, and I had to go back.
Okay. So you went back to that chiropractor
Yep.
and you got a couple more adjustments, or is
Yeah.
it just the one time?
Yeah, it was probably 2, maybe 3 adjustments there for
Okay.
that injury, but that's where it started, and
Hmm.
it never fixed itself, obviously, until we met you, you
Oh yeah, a decade.
years, yeah, like a decade later.
Yeah. So then, did you try anything along the way? So it
Yeah,
sounds like you were just locked up. Your whole back was really
yeah,
painful. Other than that one chiropractor, were there other things that you tried?
yeah, so we tried a number of different chiropractors, ones that had different, like, approaches to it,
Hmm.
like, some, like, would actually, like, pop and you'd hear the pop. There's other ones that had where you would lay on the bench and they would push down and it would, like, break,
Hmm.
like, the bench would break down,
Yeah.
and
Hmm.
so there's different we tried that. We actually went down to when I was in Melbourne visiting my sister, Amanda and John, when they lived down there, and my brother-in-law, they had this guy that you would stand on a machine and he would measure the pressure points of your feet. And his theory was if your foundation isn't right, your upper body won't be right. Right. So it sounded logical. Right. So we went and there's a little bit of an investment there to stand on this machine and it basically laser printed out or some sort of way printed out like a sole that matched your
Okay.
feet better.
Yep.
Right. And so I remember wearing that in college, however, it never solved the issue.
Okay.
So I tried went all the way from different chiropractics all the way down to, like, Orlando, Melbourne area and tried that approach. Um, I would maybe get some relief for a couple days,
Hmm.
and it would help a bit, right? But the most explanation I've ever gotten from anybody that I've ever went to was that your back is way out of whack, and you threw your back out, or your joints are way out of place, and I
Hmm.
always wondered in my mind, like, well, what does it mean that your back is out of place? Your back is you threw your back out. Like, what does that mean? Like, no one could explain to me what that meant,
Yeah.
right? Until I met you. I can talk about that later if you want.
Yeah, we'll talk about what I diagnosed you with
Yeah.
and how
Yep.
we fixed it. Ultimately, though, and this is a very negative picture of chiropractors. Your experience.
Yes, my
Now,
experience.
that being said, it doesn't mean that all chiropractors are like that, and doesn't mean that they
Right.
can't help a lot of people. We also that this is your story, right? And so one of the things that's really interesting is that even though there is a wide variety of chiropractic treatment, there's also a very wide variety of physical therapy. But it
Yeah.
sounds like you did not seek out physical therapy.
There was one place local in Pensacola that combined chiropractic and physical therapy. But
Hmm.
when I say physical therapy, I'm talking like the theory there was you have some weak areas, or when you get set, you need to then strengthen
Yeah.
the areas so your back stays set.
Hmm.
Right. So that was the physical therapy that we went through. Um, and like you said before, like like chiropractors definitely provided relief and provided healing. Like
Yeah.
they helped me, but it didn't actually fix the problem to where I could actually go and play sports later on in college and work out in college.
Hmm.
So I did miss like 4 years of playing ba love playing basketball, but every time I got done playing basketball, I couldn't move the next day. I
Yeah.
actually had pain so bad. I've never told you this. I was working on my car and my lower back went out. I had pain so bad that I was sweating in college. I remember this very vividly. I was on the top bunk and it took other people to help me get up on that top bunk. And I was, yeah, sweating. I was in so much pain. I could not, I hurt to breathe.
Yeah.
That was a lot of pain. And getting in there for the chiropractor to see that, like, it took a couple times before we could even get something to move.
Hmm.
So,
Yeah. So, man, that's intense, man. I
yeah.
know. And then,
I don't think I ever shared that with you
no,
before, by the way. So,
nope.
they just kinda popped in my mind as we're talking about it, don't really haven't dwelt on this a while because it hasn't been a problem for a while, so,
Yes. So
yeah,
let's get to that. So
sure.
obviously you sounds like you did try a little bit of therapy,
Yep.
physical therapy, very lots of exercise,
Mhm.
and in which case it obviously didn't. That sounds like it didn't help either.
Yeah,
Um,
it didn't help the
yeah.
root
Hmm.
issue. Yeah.
So I remember when I first met you, it was mainly lower back pain in your mid to low back. It wasn't the whole spine at the time.
Mhm.
Now you've had some neck stuff at times as well, because again you've had some problems pop up here and there. Do you recall how that first session went with me?
Yeah, I think I remember. If I remember correctly, we first worked on like up, right in
Was
this
it the up? Was it
vertebrae.
the
Yep,
neck?
we first moved there, and then we moved to the lower back later on in a different one, and then I recently hurt my neck at CrossFit.
That was where you would get adjusted often prior to me.
Yeah, many times, between the shoulder blades and around in that neck area would be the main thing that would, quote, unquote, "get thrown out of place," or
Hmm.
go out of place and get locked up.
You know, it's interesting you brought that up, and I know you mentioned earlier about like, well, things were all jacked up and out of whack. Things were not, they're out of alignment or subluxed. Is I know a lot of chiropractors like to use that term.
Mhm.
What they're really saying is that there's a normal alignment of the spine, and that it is not in that position.
Okay.
It doesn't mean that your vertebra that are supposed to be stacked like this on
Mhm.
top of one are now like this. That's not what they mean.
Gotcha.
What they mean is that the curve is not exactly the way it's supposed to look. And therefore, they want to restore that curve. That's a very common thing. Personally, I care a lot less about the curve and the positioning. I care more about how the joints interact with one another. And so up until that point in time with your adjustments, they were all thrust techniques. There are two problems I personally have with that. Number one is there is this neurophysiological effect. It's a fancy way of saying the nervous system gets confused and then shuts down. And so pain levels
Okay.
go down for a time, but it's only inhibited. It's not actually fixed. If that's what you need, though, that's wonderful. And by the way, if you do have something that's really stuck, you help it move better and it's all you needed, then it restores normal function and you're fine. When you get into the over and over and over and over again into perpetuity world, what I would like to say is like, when do you expect that to work?
Yeah.
You know what I'm
Great
saying?
point.
Like,
Yeah.
now I'm not saying it's not good for a certain time because I have referred people to a chiropractor, say, hey, go pop that. And it works just fine, boom, done. And then they don't need it anymore. That's
Right.
a good use of a thrust technique. The other problem I have with the adjusting like that is that it does not provide lubrication to the joint. And so everyone already knows, motion is lotion. And so you can do stretches, you can do exercises, you can do range of motion or mobility work. But if you're not actually moving the joint does not produce lubrication, which is why you kept getting stuck.
Gotcha.
And so, when I said, what's my diagnosis? My diagnosis was a pretty severe facet joint dysfunction. The facet joints are the joints that kind of rub in your neck and your upper back that glide when you move. The problem that you had is that the cartilage on the top and the bottom of that segment was not gliding on itself. And then you'd get a quick thrust and then it would move again,
Sure.
but it would never lubricate.
Gotcha.
Right. And so what I always tell people is if the thrust adjustments don't work, but they give you short-term relief, then what you need to do is some prolonged low-grade manipulation, or in physical therapy world we call mobilization, where all we're doing is we're taking that joint and we're gliding it together like this.
Yeah.
And that movement like this actually produces the lubrication necessary to have sustained relief. And that was actually your main problem in what we call your CT junction,
Okay.
where your cervical neck meets your thoracic cage, right? Your CT junction.
Sure.
How many sessions did we have for that?
I want to say was 6.
Okay. That's a pretty good deal.
Mm-hmm. It was pretty bad. You wanted to stick me with the needles. So remember you
yeah.
mentioned acupuncture, right?
Mhm.
And
Dry needling.
yeah, dry needling. I'm not even just mentally knowing. Now, if you did it when I was face down and I had no idea you were doing it, yeah, I'd probably have no idea. But yeah, just the mental thought for me is like
Yeah.
I didn't want to do it. So
Mhm.
the muscles were so tight, so deep
Mhm.
next to those vertebrae that may have helped the process go quicker. But however, we went with continuing with the manual therapy, the
Yeah.
moving of the joints to lubricate
So I
them.
wanted to do needles and you said
Yep.
no thank you.
Yep.
Yep, that's good. PTs listen to your patients and do what they say.
Yeah.
No, it's good because here's what's really cool. It's really important that therapists, chiropractors, doctors have multiple ways to treat something.
Yeah.
I mean, it's the same thing if someone comes in and says, "Hey, I've got diabetes," and the doctor's like, "Well, here's a pill," and you're like, "Well, are there any other options?" It's like,
Right.
"Well, let's talk about nutrition then."
Yeah.
Right? Like there are now different ways to treat the same medical problems, and so so it's perfectly fine to adjust that. We did a little over a handful of sessions, and what was the result of that?
The result was prolonged period of no pain in the neck. And so I could do the activities I needed to do. And I believe if I remember correctly, once we got that in the low back healed up because we moved to that
Yeah, so we
next.
moved into the low back
Yep.
at some point.
Yep. So we moved to that next. Once we got those 2 things healed up, I was able to actually get into CrossFit.
Yeah, I remember more vividly the lower back, and I remember that your SI joint was locked up. And
Mhm.
so I think that's something that a lot of people don't address. Physical therapists tend to harp on some research that says that your SI joint doesn't move, and therefore they ignore it, which is
Gotcha.
bad. And then I know that chiropractors tend to do the thrust techniques for the SI joint. I don't find them to be very helpful. Now, it's not true for every chiropractor, but I
Sure.
see their patients
Yeah.
after they do that. I mean, you come in, I'm like, well, they said they adjusted it, but it's not a problem. It's still a problem.
Yeah.
The SI joint does better with what we call muscle energy techniques, where you use muscles to pull the bones and reciprocal joints in different directions. And so for you, I remember that your pelvis was out of alignment. Some people would argue with me in that and say it's not out of alignment. I'm like, well, it wasn't moving well, right?
Sure.
And because of that, there was one side that was worse than the other. And then what happens is there's a cascade of events. So if you've got a base that's twisted, and then the segments above has to twist because your body always wants to be in like upright alignment.
Right.
And then if something's off, you have to adjust. And so that was what we dealt with there. And we got that taken care of. And this is actually one of my favorite parts of your story. I always want to say to people, well, what's next for you? Now that I've got your back or
Yeah.
your neck feeling better, what's next? And your next was, like, of all things, CrossFit.
Yeah. Yep.
How did you get into that?
We got to a point in our business where I trained up enough technicians to go out and do all the work.
Mhm.
So I was doing the estimates, right?
Mhm.
At this point, with doing the estimates all day, I'm riding in the car and meeting with clients. I'm not getting that physical exertion that I was when I was washing. So in business, if you're a business owner or any person in life, you accumulate stress, right? And I had a good friend of mine, Jonathan, and he recommended, he's like, "Hey, why don't you come to CrossFit with me? 5 a.m., you could do that, right?" So I was like, "Okay, sure, let's do it." I enjoy waking up in the mornings. And so I went to CrossFit with him. He got me in. Um, and then after that, after going there for about a year, I was like, well, hey, let's look for a closer gym, and ended up going to Lex's gym. And then you joined later on. But yeah, just being able to lift things above my head, lift heavy weights, and then strengthen like what you fixed was amazing. I got to the point in my life where it was a little depressing, feeling knowing that I was going to have back problems the rest of my life. And then if it's this bad now and I'm almost 30, how bad is it going to be when I'm 40, 50, 60, 70? And that was scary for me. And as I thought about that, I was like, this does not look good. Being able to meet, somebody like yourself and actually solve the problem and allow me to be able to do the activities that I wasn't able to do when I was 16 without being in massive pain the next day. And that pain also just, I mean, it affects you, right? You just don't feel like your full self, that you can be served to the fullest or be the most joyful, right? That you could be when you're constantly in this pain. And I mean, take that from a business angle. You're not the best that you could be for your team, and from your family, you're not the best that you could be for your family because you're constantly in pain or you didn't sleep well through the night. So now, not only were you in pain, but you woke up at 4 a.m. or 3 a.m. in the morning with pain and walking around all night until you could finally get back to sleep. So the next day, you just feel terrible. So there's so many other effects that this back pain had on me, that being able to get it fixed, not only was I able to do CrossFit, but I'm able to live a better life. Like,
Mhm.
I can go to sleep. I can actually sleep 8 hours now. I'm not only sleeping because I was restricted to 4 or 5 hours of sleep sometimes because my back would lock up so bad it would wake me up in the morning. So if you had an early morning job, not bad. I mean, you could survive on 4 or 5 hours of sleep, but I can't do that. I need 7 hours of sleep to operate at the best that I possibly can. So yeah, going back to that, not only I'm able to do CrossFit now, I'm able to just live a pain-free life and joyful life. And wow, it's made such a big difference.
As a new grad PT or a young clinician, there are two things you need: mentorship and money. We will pay you a full salary to be mentored in our customized residency program right here, and it will actually help you fix those patients you know you could have helped more and prepare you to launch your own business one day if that's something you want. Apply at our website and click join our team at www.renewintegrativept.com, and we look forward to hearing from you then.
I love the part where you kind of highlight the fact that you're limited to 4 to 5 hours of sleep, and now you can sleep much longer without no problems. And people a lot of times will blame their bed.
Yeah.
Well, my back only hurts, which sometimes is the case. Yours was all day, but like it was worse at night.
Yep.
And people go, well, my bed's wrong or my pillow is wrong. Maybe.
Sure.
I've met one patient in my 15-year career that changing the bed helped. What really is the root, a lot of times when people have pain severely in the back or the neck at night, it's usually that mobility issue that we talked about with your lubrication. Think of it as you move around all day and the motion causes lotion, right? And you have a tank and it goes higher. Right. And then when you're sleeping at night, that lotion, because you're not moving anymore, because you're sleeping, it goes down and your tank is going closer to empty.
Gotcha.
And then eventually you're at empty and then it hurts just to even wiggle just a bit. And that's what most people experience. So what you were doing is you were going to bed with very little in your tank, very little lubrication. And, that is a very consistent arthritic pattern. But at 26, 27 years old, you didn't have arthritis. Right. But what you did have is insufficient cartilage doing its job. Right. So your cartilage's job is, yes, to protect the bone and create some congruency with the joints, but also create lubrication. Yours were not creating lubrication. Now, when they don't do that, it actually causes what we would consider arthritis. It's just that definition of arthritis is less cartilage, which is another reason why cartilage does not produce lubrication. It just so happens your cartilage was just sitting there drying up, not doing anything because it wasn't moving. Right. And so that all being said, it made sense that you got worse at night. Yeah. Right. The second thing I love about what you were bringing up is that after you got physically better, you said, well, what do I want to do with myself? Yeah. And what was crazy is you went out and did CrossFit, and people think people go to CrossFit get hurt. Yeah. And now look, I'm sure you had little tweaks along the way.
We did. Yeah,
yep.
As you know.
Yep. But what's really cool is that the overall theme though was continuing to get stronger. And what I love to say is resilient. Your body became more resilient to life so that you can be all that you needed to be for your family, for your business, even personally, just for your own self. And so I think a lot of times people get out of pain, but then they don't necessarily do the next thing. Yeah. I really admire the fact that you're like, okay, I'm out of pain. Now what? What am I going to do with myself physically to either, because you do need to maintain that at some point. If you sat in the chair long enough, people are going to hurt again, and you get out and moved. That is an amazing story. What's also unique about yourself is that everything we did so far with your story has been a mechanical model where, whether it's the needles or the muscle tension stuff or, I'm working on your joints. You also got to see me kind of transition my practice a bunch. I'm curious to hear your perspective on the transition. Yeah. Because you've watched it like literally the whole time. Yeah. And I'm curious to hear your thoughts.
Yeah. So I guess the best way I can explain that is like the transition at first when you're doing it, it's kind of like, by like faith, because manually you can feel the stuff happening. Right. And then the new model, I can fall asleep while you're treating me. It's not like you're pressing hard on there, right? And it's not like you were pressing crazy hard the first time, but like the first time something's happening, right?
Yes.
You feel like
you feel worked over.
Yeah, you feel worked over, but like you all feel the results, right? Yeah. The second one was like pressing areas on your body, and then your brain's like, well, is anything actually really getting fixed here, right? It just like. So for example, you say all the time, like I got low back pain, and you're like, I came down to your big toe and treated that, and it fixed your back. It's like, how does that happen, right? But the truth is, and I've experienced it firsthand, is it's real, right? So for example, I hurt my neck really bad when I was doing muscle ups. I did something wrong. Either I didn't stretch beforehand or whatever it was, but that was pretty intense. And I came in and I was locked up, right? So we did a little bit of the manual, the past stuff on it, and just to get it so I could actually move a little bit. So then you could do the counterstrain. I just remember the manual stuff. Okay, got it to move just a little bit, just so you could do what you needed to do and figure out what you needed to do with the counterstrain. And it was like after you got done with like 3 minutes of pressing on an area with the counterstrain, you're like, okay, Tim, bend your neck to your right. And it actually went right. And I was like, unbelievable. Every time I come in, that's the word that comes into my mind. Unbelievable. Like, how do you touch a person's head and figure out where on the body is wrong, and then touch 2 areas on the body, hold it for a few minutes, and it actually has the results immediately. And my favorite thing was when you came into BNI and you brought somebody's arm back.
It was
And
you.
yeah, that's right. It was me. You brought my arm back and you're like, okay, that's as far as it'll go.
Yeah.
And then you like pressed on 2 areas and then you took my arm back for like another foot. And I'm like, I don't feel any different. Like there's no pain there. And that's just another thing. It's just unbelievable. But the amazing thing is, and the real testament is it works and it works faster.
Yeah.
It's much more comfortable. Like I said, I love coming in because it's almost like I fall asleep. I'm just so relaxed and it's a lot of fun. And so I come to you because it's worth it, right? It's not worth it. Yeah, you pay a little bit more money, but my time is valuable,
Yeah.
right? And to be able to actually have something fixed is I'll pay the money any day, right? Because I actually get it fixed. Just thinking about this earlier today. It's important that I get fixed. Okay, so talking to other business owners, right?
Yep.
If you want to be your best self for your team, lead well and make every second count because we only have so much time on this earth. It's important that we feel our best selves, right? Because having massive pain, again, it hinders, I don't think is good, right? I don't operate as good. And all that is important to me. And I only have one of me and I've got to take care of me, right? So then I can take care of my family. I can take care of my church. I can take care of the other people at my team and my business. And so it's important. And what I'm circling back to is it's worth it, right? I mean, you have insurance that you could go to physical therapy 20 times, take 20 hours of your life, but not get the results that you wanted, right? And maybe that even may cost you more over time by the time you pay your premiums and your copays and all that stuff and your gas and
There's
your
the
vehicle
calculus
wear and
there.
tear, right?
Yeah.
Or you can go to Dave and like just a couple sections and be healed.
Yeah.
I'll take that route. And that's what I do. If something comes up now, it's like I see you once, or if I majorly injure myself by doing something too heavy or wrong, I'll come in twice and I'm healed.
Yeah.
I mean, that's worth it.
It's interesting. Like, I think that you understand it from a business perspective. Not everyone does business, but the way a business person thinks is, what do I get back for whatever I'm giving up? If you're giving up an hour of your time, what are you getting back? And a lot of people who just have a 9-to-5 job or a W-2 employee, you're getting a dollar amount, right? But a lot of times for business owners, when they're giving up that hour, they're giving up either maybe mentorship or pouring into someone they value. Maybe they're giving up time with their family because they're already working a lot, because business owners don't work just 5 hours a day, right. And then you also could be giving up exponential dollars because you turn around and do those sales, which do bring in more money in the revenue in the business. And so time is money. We've all heard that. But there's obviously other things that you value more than that, even just being present for your family. I would say at least 50%, 70% of the time, we are going to save people money by paying out of pocket. And the main reason why is because of what you just said. You might be doing 12 to 16 visits with your traditional PT and only getting 50 to 70% better. But if you do 5 sessions with me, you're saving yourself 10 hours plus all the extras that go into getting there and back. And, your copays do add up. I did some math a few years ago. I've not had to really do it again, but we end up costing about the same. If you really took all the averages, and our average plan of care actually is 5.5. And we don't treat little things too at this point.
You get the worst of the worst, basically.
Yeah.
Hey, we've tried all the rest of the stuff. Dave, come heal me.
Yeah,
right?
Like, yeah.
We've been to these 50 specialists, and then it's like, then they come to you.
And yeah, we're still averaging pretty low.
That's incredible.
I will tell you, and one of the differences between the traditional mechanical model and Renew, now doing counterstrain, our average plan of care before was 8 visits.
Gotcha.
And now we do 5.5.
Nice.
We've cut out our about 35%, almost 40% of, I don't know what the math is off the top of my head. That's close. 40% of the plan of care just by being trained in counterstrain. So when you say it works faster, it does.
It does.
And we actually have the data to prove it in our systems. So I know there was a recent little flare up that you did that I think is particularly powerful for counterstrain. Wow. And so, you've alluded to, you poke your head and you're like, well, how does that relate to anything? Fascial counterstrain is a neurological model to interpret the body that identifies where inflammation is trapped in your body. And when that inflammation is trapped in your body, it creates muscle guarding reflexes that locks things up. And then what we do is we use the lymphatic system to drain out or get rid of those inflammation proteins that are locking you up. And that's why it works so fast, is because your body goes, just gone. It gets rid of it. And then the reflex turns off. And I think that's where the immediacy comes into play. And so I remember recently you came in for a one-off. You hurt your back somehow. And you're like, my back's killing me. And you had seen someone already.
I did.
And nothing really changed.
Correct.
And that was a local treatment to the back.
Yep.
And what's interesting about our diagnostic process is that it'll tell us what's driving it. And for you, it was your cranial bones.
Yeah. Isn't that, that's crazy.
Yeah. So I remember twisting your head a little bit. Like, if you don't know, the cranial bones, they are not fully fused. They do kind of move a little bit. And they move just enough that if they do, they pull on your nervous system and can lock things up. And in this particular situation, it was locking up your SI joint. And so when you're like, well, what does your head have to do with your SI joint? Again, it's a reflex.
Right.
And it's a nervous system, and the nervous system kind of goes throughout your whole body. And so I did a couple releases there, and I remember your face was it was funny because I haven't impressed you lately. Like, you're kind of expecting, and then I did something, and your face was it was a good look. I love the look.
I don't think I can produce it right now, but yeah.
The eyes are just like, okay, like there
kind
was,
of like I said, unbelievable, right?
Yeah,
like,
unbelievable.
What you do.
Yeah. And I really enjoy the fact that we've now transitioned to more counterstrain where it works faster. And, I would have been that person too, adjusting your lower back, and it not would have worked. If we had the same problem. And I guess that's what I wanted to highlight, is that this most recent example of you doing something to tweak yourself, again, doing CrossFit, not like, sitting at a desk. You would have been the person that came to me and I wouldn't have been able to help 3-4 years ago with this dysfunction.
Gotcha.
I would have treated your lower back and it wouldn't have gotten better. One of the things that's really important to me is being like, that was God. God takes care of things. Mm-hmm. I believe that God led me to the counterstrain technique. Mm-hmm. And because of that, I get to glorify him in these things. Yeah, and I had the tools to help you back then, and it was what you needed. Yeah. And even now, God's taking care of you and giving me the tools in this case to be able to help you in these situations that I may not have been able to help in the past. Yeah. I don't know. I just really, I love the fact that God does that for us.
It's interesting. I was actually reflecting on it today, like just how blessed we are in a family. And now that you say that, it's a blessing, to give glory to God that he allowed me to meet you, to be able to fix my back. It was a disheartening thing to think about in the future. Where am I going to be if I'm this bad already? Right. And I've had people tell me that too. They're like, dude, you have back trouble? Like, you're young, man. How do you have back trouble? Wait till you're 60. And, people joke around like that, but that stays in your mind because you're the one experiencing it. And so, yeah, to get that relief, I am very grateful.
Yeah. God takes care of his people.
Yes.
And in so many ways, you walked this journey for a long time. If someone's dealing with severe chronic pain,
Mhm.
what would be some of the things that you would want to tell that person? And doesn't necessarily mean that go see Renew or Dave or whatever. Like that's sure. But someone might be in Alaska, someone might be in Montana. Like, what does it look like to deal with this from either a mental perspective or, was there a certain thing that got you through those years where you weren't getting relief that you feel like would be important to impart to someone today?
I think what I would say is, wherever you are, maybe you're in a different state, you're not right here local to, Dr. Dave. I would say this mentally, know that there are other alternatives and don't give up. Don't give up looking like many times we get ourselves maybe in a box where we think, okay, it's only the current medical system that we know that is all that's out there. And there's beginning to be other things like, okay, so take, for example, counterstrain out of the picture for a second, take direct primary care. I grew up my whole life. I'm 32 now. I never even knew what a direct primary care doctor was until a year ago. And they're a doctor that will help you by paying a monthly fee. But you can see them anytime you want. You can call them, text them, see them 5 times a month if you want. There's no extra cost to you, just what you pay. So that's just a different example of there's other things out there and I didn't know about it. So I would say if you have a chronic issue, don't give up. I would say, if you're spiritual, you believe in the Lord, ask God because God says, He knows our needs and you have not because you ask not. So ask the Lord. Start there and then search out online. And if you're local, my recommendation, I got healed by Dr. Dave. I would see Dr. Dave. I would go online, look for counterstrain, look for a different place that may be in your area. They're starting to expand, right?
It is a very hard process.
Okay.
There are more and more counterstrainers every year. Of
Okay.
course, I would still say in terms of high level counterstrainers, because you can take 2 classes and call yourself a counterstrainer.
Gotcha.
But there's over a dozen.
Okay.
And then there's follow-ups and there's extra trainings. There's a lot of things.
Sure.
I will say though, if you go to www.counterstrain.com, there is a practitioner lookup. You can find someone who does counterstrain.
Yep.
Personally, that's what I do when people call in and say, "Hey, I'm from Atlanta. Do you know anyone around here?" I'm like, "Well, just go to counterstrain.com."
Yeah.
And you'll find myself and my colleague Isaiah Recantina here who does counterstrain. We do, all of us here at Renew do counterstrain, but different levels. And so what's interesting about it is to be on the website, you need to make a certain level.
Gotcha.
And then not everyone's certified. There's probably only 100 certified counterstrainers in the country.
Okay.
and Isaiah and I are 2 of them.
Gotcha.
And so, and by the way, this is also not about counterstrain. People may have medical ailments that are not responding well to traditional allopathic medicine.
And define what you mean by allopathic
Yeah,
medicine.
just normal doctors. Just go to your
Gotcha.
your MD at the hospital setting. You go to the doctor. Doctor's going to be there for you for 5 minutes. He's going to ask you about a bunch of questions,
Yeah.
and you're going to take your blood pressure, and you're like, "I'm 30, I'm fine. Why are you doing that?" And that's half your visit is taking your blood pressure.
Sure.
And then that's allopathic model.
Gotcha.
Where it's your traditional Americanized Western model. But when we talk about integrative physical therapy or integrative medicine or functional medicine, or naturopathic medicine, what we're really saying is, are there other models other than surgery and pills, right? Because that's allopathic's go-to. Now, don't get me wrong. If you need surgery, if you have appendicitis, you go get yourself some surgery.
Like I did last year. Yeah.
If you break your bones, go to the hospital. They'll do surgery for you. That's a good thing, right? If you have a bacterial infection, go get antibiotics. It's really good, right? But what I am also saying is that model does not fix everything, and that's why we have a chronic pain epidemic, and that's why we have a chronic illness epidemic, because we're trying to use the same model for all things. And for example, as I said earlier in our talk together, there was a time where that manual therapy mechanical model worked really, really well for you. And then your most recent flare up, if I had done that, it wouldn't have worked.
Gotcha.
The counterstrain model worked for you. And it's okay to have multiple models to work within. And it's okay to step outside the traditional model to actually find your answers. And some of it sounds a little kooky, but that's marketing, baby. You know,
Sure.
that's what it is. It's marketing. People will poo-poo the naturalistic side of things. You're like, oh, that's dumb. It's not as strong as medication, or it's not as effective as surgery, until that's the answer. Right, as opposed to the surgical or medical side thing. So, Tim, thank you so much for coming. Is there anything else you want to say before we end?
I love working, with you. Like, thanks for everything that you did for me. You've changed my life physically, which affected all the areas of my life. So, from the bottom of my heart, thank you. And I appreciate our friendship as well.
Yeah.
Times we get to spend together, ping pong, grabbing steak, all that.
Yeah, we do fun things together.
Awesome. I love that. The other thing I love is that you take really great care of my referrals. I've sent a lot of people your way, and I hear the testimonies back. I've one lady from our church could not exercise after her pregnancy, and you healed her. And she referred another lady in my church who, after her pregnancy, she couldn't even get up and go outside and play with her kids or exercise or anything. And she wrote a massive Google review. If you want to check it out, look on Google. And somebody that subbed for you in BNI read that Google review. And I was like, wow, that's an incredible Google review. Who did that? And I looked it up, and I was like, oh my word, I know that lady. She's in my church. And then I talked to her like 2 weeks later. I was like, hey, so-and-so referred you. And she said, yeah, they did an amazing job. She's just like, I've never been in this worse state in my life. Like, it was so bad. And you helped her through that. And I was like, wow. That's amazing. So thank you for what you do, and thank you for the friendship.
And just to get personal here, like, going through the counterstrain training was really hard. It was really hard. And there were times where I did not want to do it. A lot of times. And that's probably one of the reasons why there's not as many counterstrainers. It is a hard thing to do and learn. And you have your testimony to what I was doing already was working.
Yeah.
Like, why even try? Why change anything? Right.
Sure.
But it's those testimonies that remind me and make every ounce of that hardship worth it. I appreciate your friendship. I appreciate, yes, your referrals and your business. But most importantly, I feel like we get to serve the same Lord and Savior. We get to honor him in all that we do. When you send someone to me, it's not a number. It's just not. It's a person. It's a life. It's an opportunity. Just like you said, like I changed your life. Like, that deeply moves me. And I'm like, I get to change lives. Now, it doesn't mean we can't change lives in any business. It's not about the roof or the cement.
Yeah.
It's about how you love others in the midst of a process. It's the same thing for me. I'm cleaning up the body, and I get to truly serve and love and take care of somebody in a very hard time. When we get to change lives like that and then hear about it, like, I don't even know who you're talking about. And it just feels so good. It makes everything worth it. And so I really appreciate all that.
Yeah.
So anyway, on that note, everyone, thank you so much for joining us for another episode or another segment of Patient Perspectives. If good outcomes matter to you, subscribe and follow wherever you're tuning in. If you're a new grad or a young clinician and you're frustrated with the system and its outcomes, go to renewintegrativept.com, click Join Our Team to learn more about our residency program. And remember, healing is possible.